Hey guys, Dan here with Pain For You. Today's topic is going to be, which side of the fence are you on? Or are you sitting right on top of it, and the foot dangling over either side? What I mean by that is, do you believe your pain or other symptoms are physical? And you believe the diagnoses that you may have been told by your doctors or pain specialists? Or do you believe that it is as a result of TMS, distraction pain, stress illness? Which do you believe? And I would love for you to pause the video and comment below before I get into the rest of it. So please tell me, do you believe that you have TMS or distraction pain or diversion pain syndrome or mind-body syndrome or whatever you want to call it? Or do you truly believe that whatever symptoms you are experiencing have a physical component to it? And the first thing I will tell you is that you cannot straddle the fence. I've run into several people who said, yeah, I believe my back pain is, but this other symptom, no, that's physical. But I got rid of my back pain, that doesn't bother me anymore. And so what we believe tends to be true, right? If you believe you cannot heal a certain symptom through this mind-body process, you are correct. If you believe you can, you are correct. Okay. So which side of the fence are you on? And I will tell you clearly, you cannot straddle the fence. If you say, well, I think it may be physical, it may be TMS, I'll try this for a little bit. Try is basically a fancy word for I'm gonna give myself the impression that I gave it a shot, but I'm expecting it to fail. We don't try, we do, or we don't. The example is, you're sitting in a chair, try to stand up. Okay, and if you go like this and you get up, there, I tried to stand up. No, you didn't try to stand up, you stood up. Well, if you try to stand up, what happens? Well, I'm thinking about it. You get my point. Trying isn't a good word to use in your vocabulary because it presupposes failure, but at least you can pat your back, and say, yeah, but I tried, right? Commitment, decision, these things are really important. And if you are straddling the fence thinking that some of this stuff is physical, some of it is mind-body, keep in mind, the mind-body causes real physical reactions. So if you feel like you've got tight muscles on your back or in your shoulder, and I'm really tight, so that must be the problem, so let me get it massaged, let me get, physical therapy to loosen up these tight muscles, you've missed the point. The muscles are tight because of these overwhelming, unresolved emotions. So for me, in the last post, I just posted a picture of how crooked I was. Every time I tried to work on straightening up my body, I was confirming in my brain that my body was at fault, and it wouldn't let go of the distraction mechanism that was causing the pain in the first place. So I could not straddle the fence, and I proved that really well. Even after 10 years of knowing about Sarno, 10 or 11 years, I still went to the physical therapist to try to get straight. A little piece of me still had some doubt. When did I start getting better? After I fired that darn physical therapist who just looked at me like, you're really whacked out. So my encouragement for you is this. If you are straddling the fence, hop over onto the side of mind-body syndrome, TMS, stress illness, distraction pain. The water's fine over here, folks. There's really no harm in letting go of the false diagnosis that your doctors told you about some herniation or spinal stenosis or sciatica or tendonitis or repetitive strain disorders or whatever they've told you about your symptoms. If you have followed the medical protocols and it hasn't worked, it's likely because those medical protocols are treating the symptom, not the original cause. So I would firmly encourage you to take your feet off of the physical side, swing them over, and drop down into the mind-body side of this equation here, and really commit and say, look, I've tried all the medical stuff. I've tried treating the body. It hasn't worked, whether it be gastrointestinal problems, headaches, weakness, burning, numbness, tingling, pain. It doesn't matter. If you've tried the medical treatments and it hasn't worked, that's probably why you found Dr. Sarno and have been reading about it. But you can't be walking around kind of indecisive and going, well, maybe it's TMS, maybe it's physical. I'm not really sure, so I'll try this TMS thing, and oh, it didn't work for me. I tried it and it didn't work, so it must be physical. Well, look, maybe the symptom didn't let go because you were still walking around saying, I'll try it, but I still think it's physical. So you got to make a decision. You got to make a firm commitment to yourself. You got to take your foot off of the physical side and swing it over the fence and drop down into the mind-body side completely. So, does this resonate with any of you? There was a recent post in one of the other TMS groups, and a lot of people are still clinging to the diagnosis or the prognosis from their doctor that says, you're going to be in pain the rest of your life. You have this now, and you're going to get worse and worse and worse until you finally need surgery. So there, you're screwed. And man, do these doctors have no clue how much damage they are doing to our psyche and our confidence and our ability to lead a pain-free life. They've got no clue. They think they're doing the right thing, but they're so not. They are causing harm through their statements. They are causing harm by saying, there's no cure, you're screwed, you either need surgery or you're going to suffer in pain, and it's going to get worse and worse and worse until you can no longer walk or work or do whatever you want. And I can't tell you how many people I've met who completely said, I reject that. Flipped over to the side and said, it's mind-body, I believe I can get better. I believe I can learn how to feel my emotions so that my brain stops trying to distract me with these symptoms. And so, really, really important for you to make that decision that you are okay. These doctors, they mean well, but they just don't know any better. So that being said, hop onto this side of the fence. The grass is greener here. And, you know, you don't have to accept the diagnosis. Well, actually, the diagnosis may be there's a herniated disc. Yes, okay. There is a herniated disc there. Great, got it. But that does not mean that is causing the pain, and nor does that mean the prognosis is really bad for you moving forward in your life. So, sure, if you see something on an MRI, great, that's fine. Ask your doctor, where's the proof, the absolute proof, that that thing that you're pointing to is causing my pain? And then ask him again, how many people have something similar to that and have no pain? And if they say, well, there are some people, say, how come? Right? Kind of call them on their statements. And yeah, it's definitely time for a decision. If you're still on the fence, make a decision. If you have evidence that what you have is TMS, then by all means, believe it. And if you've had some TMS doctor or practitioner tell you you've got TMS, believe it and start doing the work. Because as long as you've got doubt, you're not going to take the action necessary to get rid of the pain. You're not going to truly allow yourself to feel these emotions. So you got to get off the fence, folks. Get off the fence. Because straddling the fence doesn't work. You've proven that already. You got to do something different. The definition of insanity is doing the same thing over and over and over again and expecting a different result. Saying, I think it might be physical, but maybe I'll give this TMS thing a try, hasn't worked for you yet. Otherwise, you wouldn't be watching these videos. So do something different. What are you going to do different today? I encourage you to make a decision that TMS or distraction pain or stress illness is what's going on with you and your symptoms. So Make a decision, get off the fence, hop onto this side, and we'll see you on this side of the fence. Talk soon.